Laser hair removal is done here at Advanced Plastic Surgery on darn near any part of the body. As long as the hair itself is dark, thick, coarse, and evil and unwanted, we can get rid of it. Unfortunately, there has been no progression in finding a laser that's out there that will get rid of the clear, gray, kind of light blonde hairs. Like, it just doesn't exist yet because the laser itself is actually looking for pigmentation. How the laser works is it actually travels down the hair shaft. So you want clean shaven area, which I know a couple of ladies or myself, we don't like to shave anything that's on the face, but you do have to do it to just get rid of that hair that's on the surface of the skin so the diode or the laser itself can travel down the hair shaft. For layman's terms, that laser destroys the hair follicle so that it doesn't come back. What happens is there's 3 stages of hair growth, so it's not a one and done type service. You come in, a minimum, we like to say 8 times, so that we have completely destroyed that hair follicle. You're coming in, every 4 to 6 weeks to come see me, and we are doing another session, which are relatively quick sessions, because luckily I have a fantastic laser here that works so well. It's a newer laser as well, so it's not something where, I'm having to wait forever to do a larger area like a back or a full leg. It's very quick. We also keep patients comfortable here with the chiller. I use the chiller along with a couple of different, cooled ultrasound gel just to make sure that, the patient is comfortable, because it doesn't feel the greatest. The service itself kind of feels like little snaps or little pops that are done in each hair follicle with a dark hair. First time's the worst, obviously, because we're getting rid of the most amount of hair. Obviously, the more sessions, the higher I go with my settings, but the less the amount of hair. So it's not bad. It's quick. Doing an upper lip takes me longer to set up the laser itself than it does to actually do this service. It's about a 10-minute service maximum. It's incredibly popular. It's been around for years. It is something that I'm very comfortable with doing. I've done it for years myself. I've also had areas of myself done, so I can tell you exactly how it does feel and what to expect next. It's something where you want to make sure that when you do invest in laser hair removal that, you aren't going to get tan. Having patients coming in starting like end of September, October, and doing, 8 sessions or 8 months worth of sessions through the winter here in Michigan, through the fall, the beginning, end of spring, that's the best time to do it, because you're not going to be exposed to the sun. Like I said, the laser itself is looking for pigmentation, so having any extra melanin or tan in the skin is not ideal. I need to have, the lighter the skin, the darker the hair, the better the laser works. So setting up sessions in October, November are perfect. It's fantastic to get somebody in and out the door, get rid of that hair that's unwanted, and then by summer of the next year, you're good to go. It's something that you can do pre any surgery. We've definitely had gals come in who maybe were looking at tummy tucks or circumferential lifts, and everything is going to be kind of lifted, and maybe we need to do a bikini line or a full Brazilian and get rid of hairs in those areas, which is not a problem. Same with back hair on a gentleman. Nobody wants to see a bunch of back hair, so having that done is incredibly common. I'd like to say finding more gentlemen that are coming in to have like their lower neck done. That's becoming more popular. Not having to shave or get razor burn is a fantastic treat for yourself. We definitely take care of you here at APS, making it one of our perks in the fall. We definitely want to have everyone come in and get started on their regimen, because it is a 6-month, to 8-month schedule to come in and have it done. So we're always doing different perks for that service itself, but it's quick. I'm not the only laser technician here for hair removal. So getting you in and out the door is relatively easy. We're here 5 days a week for it. So it's something that once you have one area done, you're wondering why you haven't had the rest of it done. I would typically say underarms, upper lip, bikini are some of the most popular areas, but not to rule out those gentlemen having like the chest or the back done as well is incredibly popular. And like I said, super quick, not painless. I haven't found a laser out there that's pain-free under any circumstances. They're doing what they need to do. They don't feel the greatest, but we'll keep you as comfortable as possible here.